Good morning to all. Welcome you all in the ISFCP Dialogue Series 2023. In this lecture, I welcome Mr. Ranjeet Kumar, Associate Professor, Department of Pharmacy Practice, ISF College of Pharmacy, Moga, Punjab, India. We welcome you, sir, in the ISFCP Dialogue Series and your title, Effect of Anti-Hypertensive Drugs on RAAS. So we welcome you, sir. Please proceed.
Thank you very much, sir, Professor Dr. Siddharth Mehan, sir, and Sri Praveen Garg, sir, Chairman of the ISFCP, Director, sir, Professor Dr. G.D. Gupta, sir, Vice Principal, sir, Professor Dr. R.K. Narang, sir. I am very thankful to all of the members who are listening to me. And my topic is the effect of anti-hypertensive drug on RAAS. So today I want to discuss in detail about the how RAAS is working. So before going to start the effect of the anti-hypertensive drug, we should understand about the RAAS. So I'm starting from my this diagram. So this is very hot pot like a diagram, but I will clear each and every point. Keep patience. Okay. So first of all, I want to start about the what is RAAS. So RAAS, RAAS. R means renin, A for angiotensin, another A for aldosterone, S for system. So what the RAS is doing in our body, whenever the situation I am saying the situations like whenever the accident or any of the condition happen with the patients like a hemorrhage, like a reduced blood volume, hypotensions, then the blood flow will decrease. When the blood flow will decrease, there are system the system available in our body which is regulating simultaneously, like liver will secrete angiotensinogen. See here is the liver is secreting the angiotensinogen. Angiotensinogen is a peptide which is secreted by the liver. Okay, after secretion of the angiotensinogen, this will responsible to convert into the angiotensin first. Who will responsible to convert the angiotensinogen to the angiotensin first? That is renin. So how renin is secreting from the kidney? Okay, so the condition is that when the hemorrhage, when the reduced blood volume, when the hypotension will occur after an accident or any type of the situation, then the blood volume or blood flow will decrease. In which reason? The reason through the kidney having the glomerulus. Okay, there are the nephron, there is a tubule through which the blood will flow. Okay, the afferent arteriole, efferent arteriole. The afferent arteriole will carry the blood for the filtrations. The afferent arteriole having one of the specific type of the cell known as Pulkinson cell. Pulkinson cell is like a Pulkinson cell and macula densa. Okay, here you can say in this figure that is a Bowman's capsule. Okay, there is a glomerulus and there is a Pulkinson cell or Lasik cell. You can say, oh, distal convoluted tubule, then the macula densa. But I will talk about the Pulkinson cell and the macula densa. So when the blood will go to the afferent arteriole, there is a specific type of cell known as Pulkinson cell. Pulkinson cell will give the response to the glomerulus or juxtaglomerulus apparatus, where is a cell, a specific cell known as JG cell, juxtaglomerular cell, which is responsible to secrete the renin. Okay, so how the renin is secreted? What is the mechanism associated with the renin secretion? So when the blood flow will decrease, then it will give the feedback, and after feedback mechanism the juxtaglomerular cells will secrete the renin, and when the renin will secrete, this is responsible to convert the angiotensinogen to angiotensin first. Now it has been formed the angiotensin first. Now, what the angiotensin first will do? The angiotensin first will convert into the angiotensin second. So who will responsible to convert the angiotensin first to angiotensin second? There is a ACE. ACE means angiotensin converting enzyme. From where the ACE is coming? The lungs. There are endothelial of the lungs or pulmonary surface of the lungs or renal endothelium is responsible to secrete the ACE enzyme, angiotensin converting enzyme. ACE is also known as bradykinin inhibitor. This is a very specific things I am telling to you. That is the ACE is a bradykinin inhibitor. How we can correlate these things to bradykinin inhibitor? That means all you know about the bradykinin is the vasodilator. So ACE is also constrict the vessels. Understanding, we are proceeding towards the how the blood pressure is increasing through the RAAS, because RAAS is responsible to regulate the blood pressure. Means there is a condition when the blood flow is very less or BP is very less, blood pressure is very less, reduced volume, blood volume. This is the condition. When this is condition will happen, then the our kidney will proceed through the secretion of the renin, and the renin is responsible to convert the angiotensin or then to angiotensin first, and angiotensin first will converted by the ACE, and ACE is also responsible to vasoconstrictions. I am telling to you how the blood pressure is increasing simultaneously, and when the angiotensin second will form, then angiotensin second having the different functions. So angiotensin second will act on the adrenal glands. Adrenal cortex or adrenal gland is responsible to secrete the aldosterone. Aldosterone, what the aldosterone will do? The aldosterone is responsible to reabsorptions of the sodium and water. So how what will do what happen after that? When the sodium water will reabsorb, what will happen on the blood pressure? The blood pressure will increase. How the blood pressure will increase after the sodium water reabsorptions? When the sodium will reabsorb from the tubule to the blood vessels, then the simultaneously three molecules of the water will also go from the tubule to the blood vessels. Means the blood volume will increase, isn't it or not? Because when the one ion of sodium will move from the tubule to vessels, then the three molecule of water will also move from the tubule to blood vessels. So in the blood volume will increase because water is going from the tubule to the blood vessels. So ultimately the blood volume will increase, and when the blood volume will increase, the cardiac output will increase. When the cardiac output will increase, then the stroke volume also increase. Stroke volume is the one time ejections by the muscles or left ventricles. Okay, so cardiac output will increase and the blood pressure, simultaneously the blood pressure will increase. So this is the resultant. The another function of the angiotensin second is the majorly two function is that the vasoconstriction and the sodium water retention. Another part I want to discuss here, the sympathetic activity. How the angiotensin second is responsible to increase the sympathetic activity, and how this sympathetic activity is responsible to increase the blood pressure. As earlier I discussed about the sympathetic activity will increase. When the sympathetic activity will increase, this will stimulate the beta 1 receptor or beta 2 receptor which is present on the heart. Okay, so this will increase the influx of the calcium, and calcium is responsible for the contraction of the heart muscles. Okay, now the contraction of the heart muscle increase, that means the BP has been increased. Now how sympathetic activity, another way you can say, the sympathetic activity will release or synthesize the neurotransmitter specific neurotransmitter which is responsible to bind the specific type of binding sites which will give the functions as a contraction of the heart muscles. That is a specific type of neurotransmitter. Is example of a specific type of neurotransmitter is norepinephrine. Norepinephrine will release from the post-ganglionic neurons which is present on the specific binding site like a heart. Okay, now the another action, this is the action of the angiotensin second. Angiotensin second has been formed. The angiotensin function is the first one I discussed, the sodium water retention. And sodium water retention, how the sodium water retention occurs? Because the aldosterone is responsible to spare, and aldosterone is responsible to spare the potassium and give the sodium from the tubules to the blood vessels. So and with the sodium, the 3 molecules of water will also go to the blood, so blood volume will increase. If the blood volume will increase, then the ejection fraction will increase, stroke volume will increase, and the cardiac output will also increase. Then the BP will also increase. The first one is the sodium water retention. Second one I discuss about the sympathetic activity. How sympathetic activity will act to increase the blood vessels, because when the angiotensin scan will act on the sympathetic nervous system, then the specific type of the neurotransmitter will generate. And when the neurotransmitter norepinephrine will generate from the excreted from the post-ganglionic neurons, and it will act on the specific binding sites and give the specific type of the response like a heart, increase the heartbeat or contraction of the heart muscle. Now third one, the specific function is the arterio or venodilators. Okay, so when the angiotensin second will activate, then the vasoconstriction will occur. Vasoconstriction, vaso means arterio or veno, both will constrict, and when the constriction will occur, then the force of the blood ejection fraction will increase. Means the function of the angiotensin second is the sodium water retention, sympathetic activity enhancement, and the vasoconstriction. Now here I am discussing about the how the blood pressure is increasing. So vasoconstriction. After that I will discuss about the how the vasodilator will dilate the vessels. So vaso means arterio and veno. So arterio and veno constriction will occur, then the BP will also increase. Another function of the angiotensin second is the, now fourth one is, you can see here in the diagram, that the ADS secretion. ADS means the anti-diuretic hormone. When this type of the hormones will secrete anti-diuretic hormone, then anti-diuretic means diuresis को ये inhibit करेगा, means the urination will inhibited by this hormone. Means whatever the water will excreted is excreting from our body in these situations, they will stop, and the volume of blood will increase. When the volume of blood will increase, then the BP will increase. I also talk about that when the blood volume will increase, if the blood volume will increase, and when the contraction will occur, they will put the pressure on the wall of the blood vessels, so the blood pressure will increase. I want to discuss here about the one of the another things like there is a factor associated with the how it is correlating the blood pressures and how it is regulating the blood pressures by the RAAS mechanism or by the RAAS systems. So there is a system associated with this, like one of the system I discussed earlier, like a kidney having an instrument, that is a baroreceptor. The baroreceptor will tell to the system that there is a slow movement of the blood. That means the deficiency of the blood happening in our body. That means you have to increase the blood pressure so they can meet, each and every organ can meet the nutrition and oxygen supply by the pumping of the heart. Now the one system is the kidney. That is, I also tell about the Purkinje cells which having the baroreceptor. When the blood will move through the afferent arteriole, the Purkinje receptor will perceive the movement of the blood. If the slow movement will occur, then this will coordinate to the afferent arteriole associated juxtaglomerular cells, which will responsible to secrete the renin, and renin is responsible to increase the BP by following this system. Another is the macula densa. What the macula densa will do? The macula densa is associated with the ascending loop of Henle as well as the PCT, proximal convoluted tubules. Those places, the macula densa is a specific type of cell, dark cell, longitudinal cells, which is responsible to perceive the flow of the blood. If the flow is less, means in the condition of the reduced blood volume or hypotension, the flow will automatically will reduce, and this macula densa will respond toward the cell of the juxtaglomerulus. There is a slow movement of the blood, that is the deficiency of blood, so you have to increase the movement of the blood, so the blood pressure should be increased. So there is a mechanism associated. Macula densa will propagate the masses towards the juxtaglomerular apparatus to secrete the renin in very huge amounts, so the blood pressure will increase and the meat of the blood towards the different type of the organ will satisfy. Okay, so this is the mechanism. Another things I want to discuss here, that is a presence of carotid artery or carotid sinus in this region, which is regulating the which is going from the heart to the brain. So here is the carotid arteries. Okay, the carotid sinus nerve. Here is the figure in the corner side. You can see here the carotid sinus nerve is there. Here one of the bifurcations, you can see here that there is a bifurcation in the carotid sinus. Where is the situation, where is situated the baroreceptor? When the blood flow through the carotid artery, then if in the case of the hemorrhage, or in the case of the reduced blood volume, or in the case of the hypotension, their blood flow will decrease. When the blood flow will decrease, their pressure will decrease, then these carotid sinus associated baroreceptor will give the response toward the CNS, and CNS will give the motor neurons through the receptor, means through the sensory neurons, it will give the response to the brain, and the motor neurons will give the response. This is the basic mechanism. So the baroreceptor will give the response toward the CNS, and CNS is responsible to give the action of sympathetic nervous system activation. And when this activation will occur, then the norepinephrine will stimulated the secretion of the norepinephrine will stimulate, and these norepinephrine will come and bind to the specific binding sites like a heart and give the contraction of the heart muscle, because there are a mechanism associated with the norepinephrine is the calcium influx. When the calcium will enter into the cell, then the contraction will happen. So this is the basic phenomena. So I am telling about these things. The RAAS associated with the BP, means RAAS controlling the regulating the BP, blood pressure. So how it's regulate the blood pressure? When the hypotension occur, then the angiotensinogen will secreted from the liver, and angiotensinogen will convert into the angiotensin first converted by the renin. And how the renin is stimulated to secrete? There is a three mechanism I told to you. That is the Purkinje cell will stimulated, and Purkinje cell will give the positive feedback towards that, and this will secreted more the renin. And second is the macula densa will also perceive this slow movement of the blood and give the response to the kidney to secrete more amount of the renin. And third is the carotid arteries having the baroreceptor, which will give the response towards the CNS, and CNS is responding accordingly to the heart muscles. by influxing the calcium and give the response by the contraction of the heart muscles, and the BP will enhance. So this is the system through which we can increase the blood pressure. Now, this is the normal conditions. When it happen regularly or abnormally, then what will happen? The regularly the BP will increase. So then we will keep the help. We will take the help of the medicine. Okay, the management. So I will discuss in a same diagram. I will discuss the things in a single diagram. I will discuss each and everything about the RAAS, their mechanism, their management, their treatment, and each and everything in a single slide. I will discuss about that. So in this slide, I discuss about in the upper left side, that is the hemorrhage. This is a factor through which the RAAS will activate. The hemorrhage, reduce blood volume, hypotension. This will decreases the renal perfusion. Juxtaglomerular apparatus will activated by the Purkinje cell, macula densa, or juxtaglomerular cell will activated, and this will release the renin, and this will convert the angiotensinogen to angiotensin fast. Now I am talking about the medicine. How you can rectify this problem if the prolonged time someone is suffering from the hypertension. So in the RAAS system, I will try to justify all the category of the antihypertensive. Approximately 11 category of the antihypertensive I discuss in this one slide to understand the things, how the drug will act on the specific type of the mechanism associated with the specific type of the flow or which is going through the system. Now, the first one is the when the angiotensin will convert into angiotensin fast. The renin is responsible to convert the angiotensinogen to angiotensin fast. So, first one is the approach to how this renin will reduce. When the secretion of the renin will reduce, then the conversion process will reduce. When the conversion process means the angiotensin convert into the angiotensin first, when the angiotensin first formation will reduce, then the another functions or another process will reduce, then ultimately the BP will reduce. So first one drug is the directly renin antagonist, means we are antagonize the process of the renin secretion. Okay, so the first one drug is the Aegis. I'm showing here in the one places here, and the red color showing it is inhibiting the process of secretion of the renin, that is the Aegis, the first category of the antihypertensive drug. So if you are inhibiting the secretion of renin, that means you are inhibiting the process to increase the blood pressure, means you are reducing the blood pressure. So first category is directly acting renin antagonist. Okay, so Aegis. Second one is the ACE inhibitor. ACE is responsible to increase the amount of angiotensin second, which is converted by ACE from the angiotensin first to angiotensin second. Another concept behind the ACE is the bradykinin inhibitor, and bradykinin is the vasodilator, and bradykinin is the vasodilator, and ACE is inhibiting their function. That means the vasoconstriction will happen. So vasoconstriction, to reduce the vasoconstriction or to reduce the formation of second angiotensin second, we will give the captopril, known as ACE inhibitor, angiotensin converting enzyme inhibitor. That is a captopril, enalapril, ramipril. There are lots of the drug. Okay, so I am showing here the one drug, but you can add the ramipril, enalapril. Okay, like that. Now the another mechanism, the another medicine, the third category is the angiotensin receptor blocker. Means if you will block the angiotensin receptor, then this will not give the response. This will not give the response toward the sympathetic activity in enhancement, the sodium water retentions, the aldosterone secretions, and the arterioconstrictions and ADS secretions. So we will block the receptor. If we will block the receptor, then this mechanism, these functions will inhibit simultaneously. What will happen? The resultant will be the BP will low, blood pressure will decrease. So what is the drug associated with the ARB, angiotensin receptor blocker? There is losartan, candesartan, telmisartan, olmesartan. There are a lot of sartans. So ARB can be used to decrease the BP. Okay. Now the fourth mechanism I tell to here, that the sympathetic means central sympatholytic drug. Central sympatholytic, why there is a need for the central sympatholytic drug? Because this will inhibit the activity of the sympathetic nervous system. Because when the sympathetic nervous system will activate, this will secrete or synthesize the lots of the neurotransmitter which will stimulate the heart muscles. So we will decrease their stimulations or decrease their secretion. Whom? Norepinephrine. Norepinephrine neurotransmitter will decrease by the clonidine, central sympatholytic drug. Clonidine, methyl dopa. This is the fourth category. I mean, it is listing here. Clonidine, methyl dopa. These are the central sympatholytic drug, will inhibit the sympathetic activity. Fifth number I mentioned here, the spironolactone, one of the drug which is a potassium sparing diuretics. Potassium sparing diuretics means we are sparing the potassium and give away the sodium to the tubule. Means we are sparing, माने बचा रहे हैं हम, पोटेशियम को बचा रहे हैं, सोडियम को कहाँ जा रहे हैं? यूरिन में flow होने के लिए. Sodium move, if the sodium will move from the blood vessels to the tubules, that means from the blood 3 molecules of water also move from the blood to the tubules. So the urination will increase. If the urination or water will move from our body, from the blood to excreted out from the body, that means the blood volume will decrease. And our aim is to decrease the blood volume. So blood volume will decrease. If the blood volume will decrease, means the ejection fraction will decrease. The stroke volume will decrease. Cardiac output will decrease up to the mark. I am not saying that this will decrease up to the hypotension. Not. It will decrease till the dosage is given to the patients. Okay, particular dates on the particular day. So this is the monitoring event. So clonidine and methyl dopa I discussed. Okay, now the nicorandil. Nicorandil is the potassium opener, potassium channel opener. Okay, so when the potassium will open, the action potential system. When the potassium will remain open, then the hyperpolarization will occur. When the hyperpolarization will occur, then the blood vessel will dilate, means relax. If the blood vessel will relax, then it's also called as dilatation. Okay, so nicorandil will also act as the vasodilator, and when the vessels will dilate, then the blood flow will decrease, means the ejection fraction will decrease, means the blood pressure will decrease, isn't it not? So fifth number I discussed about the spironolactone, means the potassium sparing diuretics, through which we can excrete more amount of the water from the blood, so the blood volume will decrease and the BP will decrease. Nicorandil I discussed about the potassium channel opener. This will create the hyperpolarization, through which hyperpolarization the vasodilation will occur. Now the sixth has been completed. Seventh category of the antihypertensive drug is the arterio or venodilator. That means vasodilator. Vaso means arterio or veno. I will tell about the each and every things about the arterio and vasodilator. So arteriodilators associated, the example is the minoxidil. You can see the minoxidil, and another example is the hydralazine. Now the term is the arteriovenodilator, means both. It will also dilate the arteries as well as the vein. So the example is the sodium nitroprusside. Sodium nitroprusside. Now I will tell about the another drugs, a category of the antihypertensive drug. That is the seventh I discuss. Eight is the beta blocker. Beta blocker means there is specific beta cells. Beta receptor is present on the heart muscles, and when the sympathetic nervous system will activate, this will also act on the beta cells and beta receptor. Sorry, beta receptor. And when the beta receptor will stimulate, then the heart muscles will contract by influxing of the calcium. If the calcium will influx into the cell of the heart, then the contraction will occur. So we will inhibit the beta receptor, okay, by giving the propranolol, beta antagonist. Okay, so propranolol, metalol. Okay, so there are pindolol. There are lots of the specific type of the alpha, beta. Okay, so there is a alpha plus beta blocker. You can see the alpha plus beta blocker means beta is present on the heart muscles, whereas alpha is present on the blood vessels. So when you are blocking the beta receptor, that means you are blocking the contractions or contractions of the heart muscles. When you are blocking the alpha receptor, that means you are dilating the blood vessels, isn't it or not? Means alpha receptor are present on the blood vessels, whereas the beta receptor are present on the heart. So there are two mechanisms through which we can say the propranolol is the will act on a specifically this will act on the heart, or beta cell antagonist, beta receptor antagonist. Now labetalol is associated with the alpha plus beta receptor, a blocker, alpha plus beta blocker. So ninth category has been finished. Now the 10th I want to discuss about that, the calcium channel blocker. I tell each and every parts I discuss about that, the when the calcium will influx into the cell, then the contraction will happen. Okay, so the first choice of the drug, you can say the calcium channel blocker. Calcium channel means this will block the calcium, means the calcium influx will inhibit. When the calcium influx will inhibit, the relaxation will occur, and when the relaxation will occur, you can say the dilatation of the vessels will occur. So calcium channel block, if you are blocking the calcium channel, the contraction of the heart muscles will reduce, the dilatations of the vessels will occur, the BP will decrease. Now the another part is the alpha blockers, the alpha 1 receptor blocker, that is the prazosin, terazosin, tamsulosins. So there are the drugs which will act on the alpha cells. Alpha, I also told about that the alpha is situated on the blood vessels. If this will block, then the vessel will dilate. Vessels means the veno and arterio. There are different things, and accordingly the drug will act. Now the one things is remaining, that is the diuretics. The diuretics has been divided into three parts, that is the thiazide diuretics. Under this category, the hydrochlorothiazide is the example, and the one of the another subtype is the ascending loop of Henle type of diuretics. So that is the high ceiling diuretics, that is the furosemide. And the third type is the potassium sparing diuretics. Okay, or you can say the aldosterone antagonist, because aldosterone is working. What is the working of the aldosterone? Aldosterone is giving the sodium to the what, to the blood, to the blood. Sodium is moving from the tubule, means urine tubules, to the blood vessels. Okay, now if the sodium is moving from the blood tubules to the blood vessels, that means the water will also move towards simultaneously with the sodium ions. Okay, the blood volume will increase. So spironolactone, you can say that spironolactone is also as a aldosterone antagonist, through which this is the one chart through which I try to discuss about the RAS mechanism. What is the RAS? What is the associated medicines which is responsible to decrease the blood pressures, okay, antihypertensions. So this is the things. If you have any confusions or the remaining things is happening, then you may ask any question regarding to the RAS and their associated medicines which will responsible to decrease the blood pressure. Have you any confusions and any questions, then you may ask anytime. Thank you very much.
Thank you, Mr. Ranjeet
Sir.
Kumar, for your kind information. And we are highly appreciated your concern regarding this ISFCP online dialogue series. And we
Yes.
personally thank you to our management, Professor Chairman Shri Parveen Garg, Engineer Ganesh Garg, Director Professor Dr. G.D. Gupta, Vice Principal Dr. R.K. Naran, and all faculty members. And again, thank you, Mr. Ranjeet Kumar sir, for presenting this wonderful information in ISFCP Dialogue Series 2023. Thank you so much.
Thank you. Thank you very much, sir. Thank you. Thank you.